and welcome to what is the execution of a memorandum of understanding between France and Maryland, but specifically Medicen Paris region. So we're going to begin with Christian sharing with you a little bit of the background on this agreement, which has been under discussion for more than a year and is now officially being executed. So Christian?
Thank you, Judy, and thank you, Francois, and our colleagues at Paris Medicen. We look forward to this partnership, and often it's said that success begets success. And these things don't start in a vacuum. We actually started another collaboration, which was 2 years ago, at Bio 2010 in Chicago. And that was with Cancer Biosanté cluster in Toulouse. And since then, we've had partnerships with them bringing companies to Maryland and French companies starting to collaborate. And so this has been a continuum of opportunity, and we believe that innovation doesn't just reside in our backyard. It resides everywhere around the world. And as a state, we want to work with the best regions focused on biotech and life sciences. And so it is a privilege to be able to do this with Paris Medicen. If you look at the state of Maryland and you take stock of why life sciences are so important to us, as a state, we have 2% of this country's population. 8% of the industry is there in Maryland. It's the second highest concentration of biotechnology firms anywhere in the United States. From 2002 to 2010, 1/3 of all our net new jobs were in life sciences. And so for us, this is the tip of the arrow of the spear in terms of economic development, and we believe our future. We believe we have certain strengths that are unrivaled around the world that we can bring to a partnership. We have the highest concentration, I should say, of United States key federal assets that are focused not only on the cutting edge of research, whether it's the NIH or the FDA, which is focused on the regulatory side, or all the other more than 50 federal facilities working on these types of complex problems. They're based in Maryland. We have some incredible research institutions, whether it be University of Maryland or Johns Hopkins, obviously Johns Hopkins being the #1 NIH recipient in the United States. We have over 500 companies that work on this, and as a state, as a result, Governor O'Malley has laid out a plan to make it the epicenter for biotechnology around the world. The Maryland Bio 2020 plan, a $1.3 billion initiative to invest in it. We've put in place a number of policy arrangements to do so. Everything from Maryland, the Innovate Maryland initiative to send new technologies out and support new technologies out of our research labs, to Invest Maryland, which is $84 million in venture capital that we will have to prime the pump to invest in some of the most promising companies in the state, to the biotech tax credits, which have enabled over $80 million of investment in the state. So there's a number of different things that we've done, and we believe that the next step of doing this is really reaching out around the world and asking who can we partner with, who can we work together. And these things aren't simply academic exercises. And I want to give an opportunity for Scott Koenig from Microgenesis to say a few words, because this is an example of a deal that, and Scott will speak to this, is worth potentially hundreds of millions of dollars and is already in progress between a Maryland company and a company in the Paris Medicen region. And so this is what we want to enable, this is what we want to create, this is what we want to support. Scott?
Thank you very much, Christian. This past December, we entered into a collaboration partnership with Servier, who are located in Suresnes, in the suburbs of Paris. This is a wonderful partnership that we initiated with them, working together on the development of a very exciting molecule targeting cancer. We developed this molecule, discovered it in our own laboratories, and the exciting prospects of this molecule for treating virtually every solid tumor in that the target is expressed on all cancer, almost every solid tumor we've looked at, it is also expressed on cancer stem cells, the vessels that allow the tumor to grow, and is also involved in immune regulation of these tumors. The attraction and partnership between Servier and Macrogenetics is an important one. It's a true partnership. We are developing this molecule. We are in the early stages of clinical development of this molecule. We have the ability to commercialize this molecule in half the world. Servier will be commercializing it if we're successful in the other half of the world. They are actively developing clinical plans for this in the territories that they will commercialize it. And we are continuing the actual clinical development of this program currently in the U.S. So we look forward for a great success coming from this program. We also look at the potential of this partnership to develop into additional opportunities to work together, given that they came to us for our expertise, not only for this particular molecule, but for our great experience in the development of antibodies and next-generation molecules in antibody therapeutics. So we look forward to a very successful, long partnership with Servier.
How much is there in milestone payments potential on this?
So obviously, there's a lot of economics depending on successes, and with all those caveats, we will, if we get a full market potential, the adjusted milestones and certain milestone payments, it will be in excess of $300 million plus very significant royalties in the territories that they commercialize it. But again, we also have the ability to commercialize it in North America, Japan, and other Korea and other territories.
Wow, we should the best. Before I hand it off to Francois, I'm going to say, John F. Kennedy once said that the future is not a gift, it's an achievement. And the essential challenge of the present is to bring about that better future. That's what we're here, that's what we're trying to do for both the state of Maryland and for Paris Medicen. And so with that, I'll hand it off to Francois.
Thank you, Chris. It is a privilege to sign this morning this agreement and to deepen the cooperation already existing between Maryland and the Paris region. As you know, Medicen is the community for life science in the Paris region, which represent about 45% of the global research capabilities in France and 8% of the total European research capacities. So we are working with 13 universities and 30 public labs developing research and for immune treatment in various therapeutic domains. And we also count about 400 companies involved in pharmaceutical and biotechnology as well as in medtech. So, and why are we here together? We are here and we work together because you in Maryland, you have a very high medical excellence. You have the NIH, you have the National Cancer Institute, and you have very successful biotechnological company, as we see with this example. And we want to develop this agreement by defining the items and issues we want together to cope with. In fact, we are here to develop the joint cooperation in the way of translational medicine, which is a domain of excellence in Maryland as well as in Paris, and to develop the open innovation through a collaborative project. And so this memorandum of understanding is particularly important concept. And we are proud and glad to announce that the cooperation between Maryland like the Paris region does continue. We have a medicine company, Texel, which invests and develops laboratories in Middleton and in Frederick. And today we are proud to announce an agreement between the Maryland company PII and Only for Children Pharmaceutical, a medicine company. Only for Children Pharmaceutical has developed some pediatric products specially dedicated for the treatment of disease for kids. And I am sure that the manufacturing of the product of O4CP here in Maryland will help to treat the American kids too. Vincent, if you want to add.
Well, for us, thank you, François. For us, this agreement between the Maryland and Paris region is really an opportunity. And we indeed develop medicine for kids in rare disease, in cancer, in neonates, very small babies, premature. And we find the right partner to bring our drug to the market and especially to manufacture them at the highest quality. Obviously, kids deserve medicine of very high quality. And there are very few partners that can work at small scales and manufacture for the market and be flexible to this niche market. And definitely, PII is the right partner for us. So we are very, very glad. And clearly, it would have been possible to make this collaboration without this agreement. We would never met each other, and it enhanced the trust. And as well, you will come to Europe as well. So it's a both-way collaboration. So we are very, very happy with this.
PII is very happy for this opportunity as well. We want to help to make a difference for our customers, to bring the products to market. At the end of the day, the most important thing is to help children and help make a difference in their lives. So we're very happy with this collaboration.
So, gentlemen, if you will come to the table, officially execute the agreement. So as you heard, just the fact that this relationship is being signed has already spawned one agreement between a French company and a Maryland company for the development of products for children. These will be drugs that are manufactured here in Maryland. So congratulations. Let's give a hand of applause.
Oh yeah, now we have a